Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower jaw, where the doctor has asked us to evaluate bone levels on all the lower implants. So this is the panoramic view. We can clearly see that there is significant bone loss around the distal implants. And we're going to take you to the proximal or the basically the transaxial view, which will show you the exact situation. So we're going to start with the distal most implant on the lower right quadrant. So this is the lower right molar region. I'm going to zoom in for the doctors. So this is here we can see we've got significant bone loss, approximately only the lower third or just little than the half of the implant appears to have bone loss on the lingual side, whereas one third of the implant surface is left on the buccal surface, with radiolucency also developing in the remaining area. So this tooth has significant bone loss and peri-implantitis. Moving to the implant on the premolar region, just anterior to the mental nerve, this implant we can see we've got two-thirds of the implant has bone support, whereas the upper one-third shows bone loss. And this implant is placed quite buccally, but however, we do see that there is a thin rim of cortical plate on the buccal hand side. Moving to the implants which are in the central region, these are the implants. This implant has much better bone support. However, this is placed quite lingually, but we can see that the crest of the bone is in the same level as the implant. Hence, this tooth is doing quite well, and this implant is doing well, and we don't see peri-implantitis. This is the implant also in the lower anterior region. This is the lower left quadrant, lateral incisor region. This implant is subcrestal. It has good bone support with no signs of peri-implantitis. The implant in the first premolar region also has two-thirds of the implant is in the bone. However, one-third shows crestal bone loss just around the collar. We see a little bit of a radiolucency here, so this tooth might be experiencing some form of peri-implantitis, but just at the apex. The other areas we see that the implant is holding quite well. Moving just to distal to this, in the molar region, the lower left hand side, this implant unfortunately does not have very good bone support. It is quite angled as well. The implant has good bone support on the lingual side, but however, on the buccal side, we see half of the implant is experiencing bone loss on the buccal hand side. This is the axial view. On the axial view, we'll show you all the implants. Here you can see that the lower left implant here, this is quite out of the bone. The lower right implant is quite out of the bone. And as we are moving more apically, we'll start seeing that the anterior implants still have good bone support on all the sides, whereas the distal implants have bone loss. So this is the anterior region, and this is the posterior implant region. So if there are any further questions, please feel free to reach to our team. Thank you very much.